Sometimes life can bring us unexpected turns in the road. We are often not prepared to suddenly lose some of our independence. But when the unexpected does happen, we hope that you will be able to take a deep breath and relax and know that you are in the right place to continue your path to recovery. Welcome to Regional Rehab Hospital, a place where you will be assisted to become as independent as possible and to reach your full rehabilitation potential. Regional Rehab Hospital is a 48-bed acute inpatient rehab hospital that opened its doors in 2003. Regional Rehab Hospital is owned by Health South and the Columbus Regional Healthcare System. Our patients come to us after suffering serious injuries and life-altering illnesses. It is our goal to provide you with exceptional care, focusing on comfort, professionalism, and respect. Each day you will work with the most committed and experienced staff using the latest technologies available for both physical and cognitive rehabilitation. You will have an individualized treatment team that will be introduced to you during this presentation. We hope you will enjoy this video, and please feel free to present to us any questions or concerns you might have. Your medical care will be overseen by a physiatrist. This is a doctor who specializes in physical medicine. A physiatrist will work closely with your interdisciplinary treatment team to help you reach your highest potential of physical, social, and cognitive well-being. You may also be treated by one of our consulting medical physicians. A case manager is the tour guide through your rehabilitation journey. Someone from our case management staff will greet you within 24 hours of admission. Your primary case manager's name and photo will be posted in your room. This is the person that will lead you through your stay at Regional Rehab and will be your contact person for any insurance and billing concerns. Once a week, your treatment team will come together to review your goals, progress made, and implement any adjustments needed to help you return home safely. At Regional Rehab, we begin preparing you for your discharge as soon as you are admitted. A key component to this is our patient education program. Your case manager will schedule any necessary education sessions based on the request of you and your treatment team. Please do not hesitate to request further training sessions with a nurse or a therapist. Discharge plans will be coordinated by the case manager with recommendations from your treatment team. After your team has completed their evaluations, you will have a projected discharge date. This date is a goal and is subject to change. Home equipment needs will be ordered by your therapist and case manager and will be discussed with you closer to your discharge. The therapist will help you determine what types of equipment is needed and if any modifications need to be made to your home before you can safely return. Most often, our patients will leave Regional Rehab requiring more therapy in the home or in an outpatient therapy setting. We offer a comprehensive outpatient rehab program that can help you meet your continued therapy needs. Please consider Regional Rehab for your outpatient therapy provider. Once you are admitted, you will receive the Wellness Information and Tools for Health Guidebook. This book focuses on information to guide you through your stay and to continue on the path to wellness. The With book is yours to keep and take with you when you leave. This book will be reviewed with you by your treatment team and serves as a great resource for educational information. As you receive education handouts, please file them away in your With book so that you and your caregivers can reference them later. Please take this With book with you as you go to the therapy gym. During your stay here at Regional Rehab, we want your primary focus to be on regaining your strength, your safety, and independence with your everyday activities. In order to accomplish this, your stay here must be a comfortable one. Most of our patient rooms are semi-private, and room assignments are based on medical needs and diagnosis. If you are experiencing any type of discomfort with your hospital room, please notify your nurse and we will do everything we can to address your concerns. At Regional Rehab, our #1 goal is patient safety, so be sure to ask for your call light to be placed within reach when you are returning to your room, and always request help from the staff before trying to get out of bed. Your telephone will also be located at your bedside, and your phone number is listed in your with book or can be given to you by your nurse. Each bed has a TV which is controlled by your call light. We ask that all televisions are turned off by 10 p.m. to allow for adequate rest time. While recovering here at Regional Rehab, you will receive around-the-clock nursing care by rehabilitation registered nurses and our patient care techs. A typical day will start at about 5 in the morning with the nursing staff taking your vital signs and drawing any blood needed for laboratory testing. Our nursing staff will administer all of your medications. If you are experiencing pain, please remember to ask your doctor or nurse about options regarding your pain management. Please ask for pain relief as soon as your pain begins, and tell your doctor or nurse if your pain is not being relieved. Your therapist can also assist you with controlling your pain, so make sure you address all of your pain issues during your therapy sessions. Your caregivers and close friends are key members of your rehabilitation team, and we understand the importance of their support. However, therapies and treatments, including those in patient rooms, will take first priority. Visiting hours are posted in the hospital. We ask visitors to refrain from visiting in the gym unless they are here for scheduled education sessions. These sessions can be scheduled by contacting your case manager. Your case manager will ask you to designate a support person. This person can be a friend, family member, or other individual who is there to provide support to you during your course of stay. The number of visitors allowed in the room per patient is limited to 2, and please check with the nursing staff first about children visiting. We ask that if you're going to bring in any food from outside of the hospital, that you notify your nurse so that the dietary restrictions are always followed. Regional Rehab is a smoke-free facility. In certain cases, an order may be obtained from the physician allowing a patient to smoke. A special area is provided in the courtyard outside of the therapy gym. This is the only smoking area. We ask that you check out at the nursing station prior to leaving the unit. Our clinical staff will be dressed in color-coded uniforms based on their discipline. Your licensed nurse will be in all royal blue. Your patient care tech and therapy tech will be in baby blue. You will notice your occupational therapist and your physical therapist are wearing royal blue tops with khaki-colored bottoms. If you have a respiratory therapist, he or she will be in green, and your speech therapist will be in brown. Your therapy program will begin with your initial evaluation. This evaluation will take place typically the day after you are admitted. You will be evaluated by physical therapy and occupational therapy. And if you are experiencing other difficulties, you might also be evaluated by speech therapy. Once the therapists have completed your initial testing, they will develop an individualized care plan with goals that are specific only to you and your rehab needs. They will ask you questions about what kind of activities you did prior to your injury or illness. They will want to know what your home setting is like. For example, do you have any stairs? Do you use a shower or a tub? Do you live by yourself? In order to meet your specific rehab needs, the therapist will need to understand what your lifestyle was like before and what you are expecting to be able to do when you leave. Their goal is to help you safely return back to your everyday routines. Your role in this is to let your therapist know what your therapy goals are. Tell them what you want to realistically accomplish in your rehab stay. Also, you need to communicate what you would like to see yourself doing in the next 3 months, 6 months, or even a year. Your rehab process is not usually a sprint, but more of a marathon. So you and your therapist will work together in determining what you safely can and cannot do and how you can continue to achieve more independence. Your occupational therapist will work with you on getting back to your everyday living. You will hear this person referred to as your OT. Your OT will evaluate and treat your ability to perform activities of everyday living such as eating, bathing, dressing, and grooming. For example, your OT might teach you how to transfer safely in and out of a shower. Your OT will work very closely with your physical therapist to determine the best treatment plan for you. A physical therapist will evaluate and treat your functional mobility, safety, and endurance in areas such as getting in and out of a bed or a chair, walking, and possibly going up and down stairs. Most patients will be issued a wheelchair at admission. Our goal is for you to leave as independent as possible. However, we ask that you do not try to perform any activities on your own without permission from your PT or OT. Your PT and OT will coordinate their schedules so that you can receive 3 hours or more of therapy a day. Each treatment session is scheduled to last 45 minutes. Your therapist will individualize your treatment goals and exercises just for you. You typically will have therapy starting around 8:30 in the morning or shortly thereafter. You might be asked to stay down in the gym for a couple of hours at a time. For some patients, just sitting up in a chair can be exhausting. However, increasing your endurance is a key ingredient in a successful rehab. Sometimes we have to regain some very basic skills before we can perform activities such as standing and walking. Participation in therapy is not only a requirement for our patients, but it is critical in their rehabilitation success. There will be times that you will exercise in therapy alongside other patients. This is done to help provide encouragement and camaraderie. You are not alone in your rehabilitation journey, and we want you to feel supported and encouraged. If your therapist is ever asking you to perform an exercise that you do not understand, do not hesitate to ask questions. A big part of your therapy will be retraining your brain and your body to perform activities that have suddenly become difficult for you to do. Sometimes this will involve doing activities that seem silly or unnecessary. And sometimes it might involve learning how to do an everyday activity very differently. Your doctor might request that a speech therapist work with you. These therapists work with our patients to help them with their language skills, problem solving and safety awareness, memory, voice, and swallowing. If you have any concerns about your ability to chew and swallow your food, a speech therapist can help you. Other services will also be provided as needed. These may include respiratory therapy, pharmacy, and nutritional services. Weekend therapy is a little bit different. You will often be scheduled for Saturday therapy based on your individual rehab needs. Therapy on Saturday is usually completed around lunch, so please let your visitors know that you might be in the therapy gym on Saturday mornings. We occasionally provide Sunday therapy based on specific needs. This is a day that is sometimes used to make up any additional therapy time that was missed during the week. Your physician, case manager, therapist, and nurses are going to begin preparing you for discharge as soon as possible. Communication about your goals for your rehab program is a critical component to making sure we are exceeding your expectations. There is no such thing as an irrelevant question or a small request. Providing comfort, professionalism, and respect is at the forefront of our mission. Please feel comfortable directing any question or need to any staff member with whom you may come in contact with. We welcome you again to Regional Rehabilitation Hospital, a place where you will be assisted to become as independent as possible and to reach your full rehabilitation potential.